Thank you very much. We are running a little bit behind, but I would like us to take the time and welcome our next speaker, Jonathan Bones. Dr. Bones obtained his PhD in analytical chemistry from Dublin City University under the guidance of Professor Brett Paul. And then he joined the lab of Professor Pauline Rudd, who is a former recipient of the Karger medal. And then the most important thing as the introduction is that in 2010, Jonathan came to Boston and joined Barnett Institute and Barry Karger's lab as a Hastopoulos research scholar, and spent 2 years working at Northeastern University. And then in 2012, Dr. Bones went back to Ireland, where he's currently working in the National Institute for Bioprocessing Research and Technology. And he has a lab that I'm really excited to hear about. So thank you so much.
So thanks everybody, and it's a real pleasure to be here today at this 50th anniversary celebration of the Barnett Institute. So what I wanted to go through, and actually from talking to Barry in terms of putting the talk together, he was like, talk about the Institute, talk about the role it's played in your own career, which is not an easy thing to do when you sit down and kind of go through lots of different things. But the one thing that kind of struck me, and it's something which even now in terms of our communication, which we talk quite regularly, is Kargerisms. So phrases which Barry has and uses all the time. And the one which really kind of sticks, and I think which has been a guiding light for me in one sense, is the 3M, so this molecules, measurements and meaning. So that's what I want to go through today really, and to give you a flavour in terms of what we've done at NIBRT, and with the development of the Institute, really how Barry's 3Ms have really kind of played a guide in that. So for those of you who may not be familiar with us, NIBRT is the National Institute for Bioprocessing Research and Training, and we're a government-funded agency based on the University College Dublin campus, so there's also now quite strong links between UCD and Northeastern. So we're based there, and we have our own purpose-built facility. We're funded by IDA Ireland, who are actually quite close to you guys here. They're on St. Botall Street for their local office. But what we do there is two things. So we have basically a safe space to people come to and undertake training in. And then obviously we have the associated research labs and research groups where I'm based, along with many other principal investigators as well. So as I say, it is a safe space. People can come. There's been a huge influx of manufacturing activity into Ireland, but we're not based in the island, but we're actually quite global now. And we work with people across the industry, across the various jurisdictions. And so they can come, they can kind of learn by doing. It's all competency-based and ultimately go back to their own facility in a workplace-ready manner. So the past year, 18 months, even in the run-up before the pandemic itself, has been quite a busy time for us at NIBRT, and this is reflected in the diversification of a lot of what's happening in the industry and a lot of what you people are doing while working in the industry itself. So in 2020, at the height of the pandemic itself, the Irish government actually funded us to undertake new activities in the creation of training and research for the advanced therapies. So in August last year, we got the keys to this fabulous new extension, which hopefully you can see on the video here. And I wanted to show you this for a couple of reasons. One, I suppose, is to kind of highlight the links that exist between NIBRT and Northeastern, and I'll talk about them again on the next slide. Two, to show you that it's also beautiful in Dublin. It doesn't rain the whole time. This obviously is an August morning, captured at sunrise, but I think it shows off the place in a really nice light. So you can see how close we are to the sea, to the mountains. And really kind of we're very proud of what we've done in NIBRT with this facility. So in terms of what we have in the extension, we have 3 suites which are dedicated purely to training, so in gene therapy and cell therapy, and then we'll do some advanced formulation. And then on the bottom floor down here, we have a number of research labs, and we've been very happy to obviously up and bring in kind of new faculty ourselves, but we also have a new facility called Concept, which I'm going to talk to you about in a couple of slides' time. So in terms of the interactions between the Barnett Institute and NIBRT, these go back quite some time, actually probably now 15, 16 years. And my first trip over here was actually in 2008, and it followed on from a meeting between Pauline and Barry at the time at HPLC in Maryland. So at the time, Barry was doing a lot of work on the plot column technology. He met Pauline, they had a good conversation. She came back, she told me about the meeting, we had a phone call, and then it was like, you should go over there and see this. So I ended up here for a week in July, working with Barry with Kwanzaa Lau at the time. And that was the first flavour, and it, as Barry said earlier on, it did give that insight into the culture that existed in the place and that level of excitement about the fundamental science that actually occurred here. So we continued to talk and interact. In 2009, we ran some joint training, which was done between ourselves and between Barry and the Barnett Institute, with folks from the FDA as well. As mentioned, I came over here in 2010, appointed as one of the Histopoulos scholars, and that was a really, I suppose, a transformative experience for myself, because in terms of the depth of experience and the variety of things which we were involved in here, it really set me up then in terms of going back to NIBRD with those kind of career and life skills needed to be successful. Things haven't ended. They've in fact kind of snowballed since. Since returning, we had Barry as a member of the NIBRD SAB for a 10-year period. We have an MOU which we signed in 2019. We had a very nice event out on the Burlington campus back in the time. We also appointed Jared as an adjunct PI at NIBRD back in 2021. And as mentioned last year in 2023, there was much more formalised interaction between University College Dublin and Northeastern, which is great to see. So to move on and to kind of talk about what I wanted to talk to you about today. So thinking about this, and as I say, thinking about the conversations that I've had with Barry, he has a number of these go-to phrases, and I'm sure there's plenty more, and if there are, please shout them out as we kind of go through. But the ones which kind of resonate and kind of stick to me over and over is, I suppose, impact, not impact factor, which is probably a trademark or should be a trademark at this stage. As he mentioned himself earlier on, if I were a younger man, which always kind of, is one of those philosophical ones, which makes me wonder when he says it, is he really telling me that I need to do this now? It kind of puts that fear into you in one sense, which is followed obviously by the other one. My nose tells me that this would be important. Again, you're sitting there kind of going, I think I need to go read and Google this straight away. Something which we'll talk about later on, so what? And I'm surprised you didn't have that on your slides, but so what, so what, so why are we doing this? Something which you did mention, don't be afraid to try new things and to reinvent yourself, and I think that's quite pertinent and definitely something which, even reflecting on my time since going back to NIBRD, which we've had to do a number of times. But the one that I'm going to kind of go through in a little bit of depth, obviously, is the 3 M's, so molecules, measurements, and meanings. And I think even, Barry, you mentioned this yourself in one of the slides, when we look at kind of the field at the moment, and we look at a field which is talking about its own kind of future direction and its identity, actually, Barry's 3 M's have now, I think, never been more appropriate. And I think that's kind of something which we should probably reflect on a little bit. But particularly when we look at the actual application of analytical chemistry in the life science and the biotech sectors, this is going to be huge. So let's move on and talk about M the first. So molecules. Simple statement. Molecules are the basis of everything that we do. So regardless of what our instrumental analytical method of choice is, we're measuring something. We're measuring a molecule. But they're getting more and more complicated. So particularly now focusing on kind of using the track of the biotech field here. So the question that we have to kind of consider as analytical people is, the methods that we're going to develop, are they actually relevant? Are they reflective? Are they impactful of actually what we actually want to measure on the molecule itself? And this made us kind of think about this and reflect about it a bit more. So the first thing with this is, for people working in, for example, advanced therapies, some of those molecules aren't available. So how are you going to develop methods if you can't actually access the materials that you need to develop methods for? Some things are out there, but the quality's not great, and then you have the old adage of garbage in, garbage out. Some materials, if you can get them, you're going to get very little, or you're not going to get them at all. So for example, things like CAR-T, if that's coming from a patient and going back into a patient, well, we don't have the luxury of taking some of that and playing with it for analytical method development. Particularly now as we start to see the developments in the field, companies don't want to disclose this information. It's very IP tight. So analytical people, we want details, we need sequences, we need to know what these things are made of. How are we going to develop solutions if we don't know what we're working with again? If we think about where we're going in the future, and again, Olga mentioned this with the future and AI and all these kind of wonderful things that are happening, what's that going to mean from the meaning aspect? And we'll talk about this a little bit later on. But ultimately, with all these sort of things, because this is such an active system and an active startup ecosystem, well, how do we help them? So how do we actually do what we're supposed to do and bring those 3 M's together? So this really was the driving force behind one of the initiatives which we developed at NIBRD in 2021, which was funded. and which we've now brought to fruition, which opened basically on the 8th of December last year, which is a new institute called Concept. So let me give you an overview of what Concept actually is. So concept is a play on the word. So if you look this up in the dictionary, what it means, obviously it's an abstract idea or a plan to achieve. And that's exactly the whole genesis behind why we've created this facility. When we kind of think about this a little bit more, part of the issue really with this was the pandemic itself. Okay, so as mentioned, we sat at home, we weren't able to do science for quite some time. And then you saw this emergence of new technologies, things like the RNA, and where it came from at the speed at which it came from. So I remember at the time sitting at home in 2021 and seeing a video on YouTube from Moderna and basically how they do it. So they design, they have it, they manufacture it, they get it, the speed at which they can actually do these things. So asking Barry's question, so what? Or more so why? So why couldn't we do this? And that was the genesis of why, well, let's go after it and create a facility such as Concept. When we looked around, there was nothing in Ireland. There's nothing in Europe equivalent to allow us to do this. Not so sure about North America. We didn't look across the ocean that far. But it doesn't matter. This is designed to be there as an asset for the world. The whole idea with this, it's for early stage activities. So we're not going to go GMP. We're there to kind of work with people and to do that transition then afterwards. But really to allow for those value-add experiments. So for people on that commercialization journey, they can bring their science, they can bring that molecule to a whole different level. The other thing with Concept is it finally unlocks the potential of NIBRD. So as I say, we have pilot capabilities, we have the ability to go to scale, we have the ability to have high throughput fill finish capabilities. Before that, you had to have a product to work with us. Now you only need an idea. So it's this whole ability to unlock molecules and to make sure that we have and we can generate things which bring that relevance to the first STEM as we go forward. So as I say, and as you've seen in the video, it's designed across these modality flows. You saw the branding and the color coding, but really to be there for sequences, for antibodies, biologics, etc., for RNA, for cell, and for gene therapy as well. The big advantage with this, we've been very lucky as part of our recruitment. We've managed to bring a core group of people together, and you've heard the message of how important people are through all the different presentations so far this morning as well. So we've been lucky, we've trawled, and we found people who come with experience. So Sakraj comes to us from BMS. He was leading a cell line development lab over in India. Julia comes from Spain. She has huge experience in AAV. And Brian basically was with Markham Poulet over in Imperial College, so one of the people who has been in CAR-T since the earliest stages. So we're very lucky in this regard to bring this technology into this new facility now to kind of drive the whole first STEM in the development of high-quality molecules, both for people to use as part of the early stage therapy development, but also for us to have and to share with the community in terms of making these accessible for those who want to develop analytical methods. So the capability exists. We have everything, as I say, for all the kit and toys for sequence generation. We've looked at these in terms of connectivity, and this will come later on when we talk about meanings, but how we now link that interface between designing molecules with some of the technologies which are emerging from AI. We have the ability then to do rapid biologics development. You can see a video here, but for example, one of the instruments we have, this beacon system from Bruker cell analysis, that reduces the cell line development process from 8 months to 5 days. And we've been running this already in-house to kind of do so. We have the associated capabilities for RNA, for oligos, etc. Also for gene therapy, very similar to standard cell culture for things like AAV. But for cell therapy, we've gone very much into the functional analytics space. So not only now can we make CAR-T, can we make cell therapies, we really want to be able to understand what they do. So that third M, that meaning the whole time. This is obviously supported then by what we do with the wider research activities. So really, as I say, we're quite happy there's an image missing here. But it's important in terms of what we can do now for that first M. So to bring molecules, to make them available, and to really hopefully help the community in this regard. In terms of the second M, so thinking about this again a little bit more, one of the key things which we're seeing, obviously, and as I've mentioned, is this increasing complexity in the molecules that we have to analyze. And that's a challenge. It's a constant challenge. Thinking about this again a little bit more, this complexity, it's not solely associated with size. So obviously we've gone from small molecules to proteins, to genes, to cells, etc. But that's not it. It's actually kind of the distribution of various things. And we had a strong discussion at one of our own SAB meetings the week before last with Robert Baffy, who I think again is an alumnus of the university, about kind of something like deamidation on a viral protein on a gene therapy and its role and function. So it's all these kind of very, very small needles in now ever-increasing haystacks. So we're also seeing things like, antibodies becoming a little bit more platform and running the risk of being done, so to speak. But we see this now as they become more and more complex, as they become scaffolds, they're far from done, and there's plenty more for us to do in this regard. The bottom line, I suppose, the takeaway message here, it's probably never been a better time to be an analytical chemist. And really kind of, I suppose, it's a pleasure to say that in somewhere where there's such a wealth and tradition, as indeed there is at the Barnett Institute. So to give you some examples, and I'll flick through these quickly because I'm conscious of time. We started doing a lot of work in terms of RNA. Obviously things like mRNA, but actually we've switched over the past year to things like ASOs and siRNA because there's a lot of work to be done. And actually the fundamental thing here is separations. It's not the mass spectrometers. They're exquisite in terms of what they can do now. It's actually back to being core separation science, something which an institute like this has actually stemmed from. This is the nub of the issue in which we actually kind of see these things now. We've looked at this again, as I say, for things like the viral vectors for gene therapy. We can play around, we can do all these sort of fancy things when we have the actual analyte inside the mass spectrometer. We can shake it up to kind of make it dissolve better, to make sure we get very nice high resolution MS analysis, all these kind of wonderful things. What we're seeing though, in terms of the actual measurements, is technologies which were very much researched. Things like top-down proteomics. We've mentioned hydrogen deuterium exchange earlier on. They now need to become much more mainstream because, for example, to address some of the challenges which we see on things like AAV, we have to resort to top-down proteomics. Unfortunately, things like peptide mapping just fails because we have sequence degeneracy. So there's issues there, and as I say, it's exciting. It kind of puts the pressure on us to kind of do more things. We've done a lot of work in the native space because, for example, when we look at bispecific or multispecific antibodies, the only way to analyze these things is actually to keep them intact because they're very, very fragile. So we have to optimize, again, our separation chemistry and our mass spectrometry to actually allow us to do this. And an area which we've had a lot of kind of focus, particularly now as we move towards the meanings and look at the future in terms of AI and a lot of the things which are coming, is automation. So how do we actually kind of remove the person from the process and the person from the analysis? So we've looked at creating these integrated systems whereby we don't have to do that. So if we have autonomous process control based on the analytical data, based on feedback loops, etc., and that's now possible to do, as you see, using systems like what's kind of outlined on the slide. In terms of the data, it's deep. It's incredibly deep, but that's very, very important because you can't do data analytics without good analytical data. And I think there's kind of an important message there. But we can look at this, we can kind of see, how we do this from a development point of view, how we might translate it forward. Maybe this isn't the future in terms of what ultimately goes into manufacturing, maybe if it's a simplified approach. But it's good to do these things, and it allows us then to bring things forward and to really understand in depth what's actually going on. So just to wrap up, in terms of the third meaning, as a wise man once said, and I think he said it again this morning, so what? So this has been the focus here. We generate lots of information. Okay, everybody in this room, we're used to living in the digital age now, but even as analysts, we generate so much information. So how do we actually extract what's actually useful and what's knowledge from that? So our approach within my group at NIBRT is actually to look at this in 3 ways. One is, let's make it simple for the people who are actually not necessarily employed to think, but rather to do. 2, let's look at the autonomous control strategy where we remove the person from it. And now the third one, which has come up, particularly in the last year, is how do we take the 3 M's to new horizons using things like diffusion and, again, some of the technologies which Olga mentioned earlier on. So how do we link them together and bring things forward? So in terms of the first one, really what we've been doing, and we've worked very closely with the folks in Thermo Fisher Scientific on this, is how do we simplify reporting? So you have QC labs, you have high churn, you have high levels of people there who have to get molecule out the door. It's their job to basically kind of generate the information which releases this onto the market. So they need to do things, they need to know that the method is working, they need to know that their data is good. So we focused on this, we've worked closely with Jared on things like multi-attribute methods, and I saw that mentioned closely on some of the slides earlier on. But our focus has been, yes, 1 on the technology, but 2 on this actual meaning aspect, because, you know, the fear with the implementation of a new technology is, well, it's going to create too much data, and that data is going to create a bottleneck. So we wanted to kind of solve this and to make it as simple as traffic light reporting, simplified reporting to make sure that people can do this, one-click process, get their answer, move on. We've done this again in things like the gene therapy space. This is work which we did with the folks in Brammer Bio in Alachua in Florida. So a multi-product facility making different serotypes of AAV. They wanted a very simple click, push button test for purity testing. So what serotype do I have? What serotype is there? What modifications are there? So again, it's that in-depth analytical chemistry happening underneath the hood, but with an interface around it which gives someone an answer that they can move on from. In terms of the second approach, what we've been looking at here in terms of the autonomous process control is really how we can generate that information to allow us to do that, to remove people from the process. And we've all heard about things like neural networks and convoluted neural networks and all this sort of fun stuff which is happening at pace at the moment. Sometimes they don't work, and this is one of the problems which we had. So we had to look at different ways to do this, but you can do it, and there's such a wealth. And actually one of the things which I think is really important, there's such hype about AI at the moment, but take comfort in the fact that a lot of the algorithms and the maths which are actually behind AI stemmed out in the 50s and 60s. So they're there a long time, and now we just have the power and the data to utilize them. So this has been our approach here again. But we can do this now, we can generate predictions, those predictions are very accurate, we can use that information to feed back into the process to control it, and now you don't need people. So really the key question is that rather than having a process engineer, maybe you now have a process prompt engineer who can use things like large language processing, things like ChatGPT to ask the process questions and really kind of get more insight into what's actually happening here. And then finally, with things like concepts, now with an engine to generate these molecules, combined with their ability to measure them, we're looking at some things like, for example, the excellent stuff which is coming out of David Baker's group in the University of Washington, to see how we use these protein design tools to make better ligands, to make better whatever it might be, better molecules in the first place, to bring this whole field forward. So hopefully a very, very quick run through in terms of 3 M's from a wise man, which has provided a guiding light in terms of the development of a career, and again, an institute somewhere across the Atlantic in this. Thanks to the folks in NIBRT involved, but thank you, Barry. You've played a key role in this, and you've been an absolute excellent mentor. There's a picture, you can see him, he's a shadow here, but this was a trip over to Dublin where we went to Burke Castle, which is down in the Midlands, but it's the largest telescope in the world, so this kind of early telescope was the Earl of Ross developed it. So it's a fabulous place, again, science through the centuries. But thanks to you all, and congratulations to everybody up Northeastern and to the Barnett Institute on reaching this golden milestone, and here's to many more years ahead. Thank you very much.